My name is Jean-Paul Duguay. I'm the ACT team leader at North Central Bronx Hospital. ACT stands for Assertive Community Treatment. Essentially, we operate as a mobile mental health clinic providing mental health and supportive services to clients on our caseload in the community. It's a multidisciplinary team filled with different specialties ranging from psychiatry to social work to addiction counseling and so on. And we work collaboratively to assist our clients with, achieving their desired goal of a life worth living. Our program's main goal is to have our clients minimize the amount of psychiatric hospitalizations in the community and to promote more opportunities to socialize, to find work opportunities, to essentially create a life that's worth living. A lot of times, our folks don't have anyone to support them. They don't have family. They're isolated. And our ACT teams are really what they have for support. But, being able to be privy to, the circumstances that we see. I mean, mental health can affect, this population, men specifically, in a various number of ways. So much so that, like, you begin to neglect yourself. As much services that are available, as many resources that are out there, if you're not willing to, address your mental health or even just make change, right? If you're not willing to do it, nothing will happen, right? And the cycle will continue to happen. And oftentimes, especially within the context of ACT, as we receive new cases, a lot of the times the general disposition of our consumers are that of not needing to address their mental health or not needing to, take medications and so on and so forth. However, it's essential, right? Especially if they're being referred for ACT because, ACT is a higher level of care in terms of just the outpatient hierarchy. So like if a client is not able to make and keep appointments with their outpatient program, and if they have a number of hospitalizations in the community, they're eligible to be on an ACT program. Like, I come from these communities where mental health is frowned upon, or mental health is really not anything that's talked about. I come from these communities, and in navigating throughout my career, it became pivotal, and it became important for me to show up, to show folks that taking care of your mental health is worth doing. Look at the product of what's happening over here, right? If we don't take care of your mental health, it's essentially, it's a recipe for disaster. And in my pursuit, in my career in social work, and just ultimately being a therapist, it became important for me to show up in those spaces, right? To allow folks to see that, there's more than one person that is here that they can relate to.